Smiles Better Award scheme was developed in response to national surveys that showed that there were high levels of decay rates in 5-year-old children in Gloucester and the Forest of Dean. Now, there was only me to work on this programme, so I had to work smart, and the idea was to team up with preschool settings, early years, nurseries, playgroups, private nurseries, just really to get them to work towards targets to improve oral health and healthy eating. I had poor oral health as a child. I remember visiting a dentist and having that mask put over your face, and that put me off going to the dentist. And what we wanted to do was turn that around for children, familiarise them with going to the dentist.
Oriel identifies members of staff within the preschool settings to work as a champion for that particular setting, to work towards the Smiles Better Award scheme. So they receive some initial training. To date, there's been over 100 of these members of staff who've been trained. There are a certain number of set criteria that they aim to achieve annually. They receive regular visits from Oriel, and each of these members of staff are required to keep a portfolio of evidence. At the end of the year, if they have achieved all of the criteria, then they receive their Smiles Better Award certificate. The levels of decay amongst 5-year-olds in Gloucester and the Forest of Dean have reduced by approximately half since 2012, since the introduction of the Smiles Better Award scheme.
What we would like to do is to develop the award to make it a healthy preschool award, so it incorporates not only oral health and healthy eating, but physical activity targets, and just build on that year on year. So each year they would have another area of health to look at, to build upon. So that's the plan.